So, fortunately, there are several effective treatments that are safe treatment options for both postpartum and lactating individuals. So, one first line option is pelvic floor physical therapy. So, that can be very helpful, particularly when the pelvic floor is hypertonic or very contracted, or there's scar tissue or neuromuscular dysfunction that can all contribute to pain, particularly pelvic pain or pain with intercourse. So pelvic floor physical therapy is, non-invasive first line that can be very helpful. But secondly, one of the stars of the show is vaginal estrogen. So vaginal estrogen therapy can address the hypoestrogenetic component of these symptoms. And so we have evidence from populations that suggest that low dose vaginal estrogen has no systemic absorption, and so it's considered compatible with lactation. And so basically, studies and clinical experience indicate that local vaginal estrogen does not meaningfully affect breast milk production or breast milk supply and does not result in a clinically significant transfer of estrogen into breast milk. And that's a really important point for both clinicians and patients because we have this fear of hormonal exposure that may often lead to unnecessary avoidance of treatment. And so when used at low doses and applied locally, vaginal estrogen is widely regarded as safe and effective option for postpartum individuals who are breastfeeding and experiencing these genitourinary symptoms. We also have several non-hormonal options that can play a role, such as vaginal moisturizers, lubricants, and things like that. But interestingly, our study, we had pelvic floor physical therapy and vaginal estrogen were the most commonly recommended treatments. And so it also just goes to reinforce that these two treatments can be effective and are both safe for this population. I think the biggest change I would advocate for is routine screening for genitourinary symptoms proactively in the postpartum period, particularly individuals who are lactating, but really anyone in the postpartum period. Because given the hormonal physiology of lactation and postpartum, these symptoms should not be viewed as unexpected. They are predictable consequences of a temporary hypoestrogenic and hypoandrogenic state. And so, practically, this could mean incorporating a few targeted questions in postpartum visits on genitourinary syndrome, such as if they're experiencing vaginal dryness, vaginal discomfort, pain with intercourse. And so from there, clinicians can offer counseling and treatment options, like I mentioned, pelvic floor physiotherapy, vaginal estrogen, other supportive therapies. I would also like to mention, I think there is a broader call to action for education. Many patients in our studies were simply unaware that treatments even existed, let alone that their symptoms had a name that they could verbalize. So I think improving clinician awareness and patient education could dramatically improve postpartum quality of life on both sides of the professionalism and healthcare.